And welcome to today's webinar with Sandra Hong, Public Education Coordinator at Alzheimer's Society Great Bruce. She will be speaking today on dementia with Lewy bodies and Parkinson's disease dementia. And before we begin, I just want to let everybody know that I hope each and every one of you is doing well, obviously in these uncertain times, and everyone's keeping their social distance, but finding hobbies that they have not been able to do for a while, and just see some enlightenment that we will all come together at the end of this. So just wanted to give everyone a little piece of hope, right? It's the strongest thing in the world right now. I also want to let everyone know that you can ask questions during the webinar. At any point in time, you can see a question mark on your panel. You just click that question mark and then you type in your question and we'll answer them at the end of the presentation. Now, without further ado, I'm just going to introduce Sandra Hong, give you a little bit of her background, and then we will move forward with the actual presentation and a couple announcements at the very end. Sandra Hong is the Public Education Coordinator for the Alzheimer's Society of Great Bruce, as I mentioned. She is a registered practical nurse and a certified master coach trainer for gentle persuasive approaches in dementia care, and a positive approach to care certified independent trainer, and You First facilitator. Her professional experience has grown from her work in hospital, community, and long-term care. For the past 11 years, her role has been to educate healthcare professionals and care partners, as well as community members, on best practices in dementia care. Through the programs offered by Alzheimer's Society of Great Bruce, Sandra is able to help individuals with a diagnosis of dementia and understanding their diagnosis, and to focus on their abilities and not their deficits. Sandra helps community members better understand dementia by providing them with knowledge and understanding of how to interact with someone who lives with a diagnosis of Alzheimer's disease and other dementias, reducing the stigma and providing an environment where people with dementia and care partners are included, supported, and can live well. Sandra is currently working in collaboration with age-friendly communities to include dementia-friendly initiatives, ensuring that people living with dementia and their care partners are included and supported in day-to-day life. Welcome, Sandra. I'm so happy that you're here with us today, and I hope you're having better luck with weather than I am here in Waterloo, but you could take it away and look forward to your presentation.
Okay. Thank you very much, Caitlin, and hello to everyone on the webinar today, and eager to hear more about dementia with Lewy bodies and Parkinson's disease dementia. Just in answer to Caitlin's remark about the weather, it's no better here in Grey and Bruce. We have snow here as well, so can't put away the winter coats just yet. I thought what I would do, first of all, before getting into the nitty-gritty about dementia with Lewy bodies and Parkinson's disease dementia, is just kind of give you an overview of what exactly the definition of dementia is, and then the symptoms of dementia. So, saying that, here we go. So dementia is a severe loss of thinking abilities that interferes with the person's capacity to perform daily activities, such as household tasks and personal care, and handling finances. Dementia has many possible causes, and those could be reversible causes as well as irreversible causes, as you see in this image that I've projected here. So those include stroke, brain tumor, depression, vitamin deficiencies, as well as disorders such as Lewy body dementia and Parkinson's and Alzheimer's disease. It is not unusual to see a combination of more than one kind of dementia. So just by this Venn diagram, you can certainly appreciate the fact, the complexity of getting a diagnosis of a dementia. Some dementias overlap, and then we refer to them as mixed dementias. So not an easy diagnosis to make in many cases. And so that's why you may hear an individual say that, the doctor says that I have dementia, but isn't specific to what the cause is. Because maybe the doctor is having challenges in actually determining what the cause of that dementia is based on various combinations of these diseases. So knowing the symptoms of the disease will help you understand that the person is not intentionally trying to be difficult, and to therefore assist the person by developing strategies together on how to adapt to these brain changes. So I'm just going to briefly go over each of these various symptoms in a little bit of detail, and then just skim over them as we go further into the presentation. So symptoms include memory loss that affects day-to-day abilities. So we're tending to forget things often and struggling to retain information. So we may have repetitive questions because we can't remember what that person had just told us. Could be difficulty performing familiar tasks. So we're forgetting how to do something essentially that we've done our whole life. And that could be preparing a meal or getting dressed or checking the oil in the engine, or maybe doing a woodworking project that typically we wouldn't have any difficulties with. So something that you've done all your life, you're now finding that you're struggling with. Be problems with language. So forgetting words or substituting words that don't fit the context, and maybe not knowing what is that device that gives you the time. What do you call that thing? You wear it. It could be that when the individual is talking, that they're talking in a word salad, having difficulty formulating the words in a sentence. Or it could even possibly be, when we think about problems with language, not only finding the correct word, but also comprehending the meaning of certain words. Disorientation in time and space. So that's really not knowing what day of the week it is or getting lost in familiar places. So the individual may be able, or you may have experienced this, where you headed to the grocery store. You got to the grocery store fine, and then when you're ready to leave the grocery store, you forget which road to take in order to get home. The other piece to this is the whole space, the time aspect. So the inability of actually appreciating time. So the difference between 5 minutes and 30 minutes, not really knowing that difference. So if a loved one was to leave and say to their spouse, "Oh, I'll be back in about 30 minutes," then the individual with experiencing dementia may be looking for the person after about 5 minutes. So no idea the time concept. Impaired judgment. So impaired judgment is really not recognizing a medical problem that needs attention, or possibly wearing light clothing on a cold day, or vice versa, maybe wearing too much clothing on a warm day. And really with that, it's the inability, they may see a cut on their foot and it looks red and festered, and they see that, but they don't know enough to seek medical attention for that. Or they are cold on a day like today. They're wearing a light jacket and they're cold, but they can't, actually, probably more appropriately said, is that they feel a discomfort, but they don't know what the discomfort is related to. That, oh, maybe I need to go back inside and get some warmer clothing. Problems with abstract thinking, having difficulty balancing a checkbook, for example, or not understanding what numbers are and how they're used. I know a particular client that often says, and it has a very good insight into their challenges and their symptoms of the disease. And he'll say that, you know, I was an accountant all my life, and I realized that I could no longer balance my figures in my books, and that was very discouraging for me. Or another individual who actually said, you know, I was a transport truck driver, and I realized something was wrong when I could no longer cheat on my logbook. So, you know, things like that, balancing the checkbook or working with numbers, maybe going to the cash register and not being able to count the correct amount of change to give back to the cashier, or so forth. So that abstract thinking becomes a challenge. Misplacing things. So putting things in strange places, like a dress in the refrigerator or a wristwatch in the sugar bowl. And, you know, in these cases, a lot of us kind of, we take a deep breath and think, oh no, like I misplace things all the time. But these are particularly strange places. You know, for a person who puts the dress in the refrigerator may think, well, at the time that, this makes sense. And then they go back to the refrigerator and see their dress hanging there, and, you know, who put that there? What a particular place. And then start looking around and accusing others for doing, for putting that there, their dress there. Change in mood and behavior. So exhibiting severe mood swings from being easy going to quick tempered. And often I hear care partners identify with this, that, you know, their loved one was quite easygoing and had a great sense of humor, and so a lot of laughter was shared. And now they notice with their loved one that they do have those extreme fluctuations in mood and behavior, where they're quite happy and then all of a sudden become quite angry, which is often difficult for loved ones supporting their person. Changes in personality, and I just briefly touched on this, but it's behaving out of character for that person. So that's that becoming quite confused, that paranoid, suspicious behavior, and very fearful of, you know, maybe they're going to what we would deem a familiar place, but they don't remember that place, so they become uncomfortable in that situation, and generally, in a lot of cases, don't want to leave the side of their care partner. And lastly, it's loss of initiative. And loss of initiative, I would have to say, is probably one of the greatest risks of quality of life for individuals with dementia. This is where they're losing interest in friends and families and activities that they once really embraced, they're now withdrawing from. And really, we have to remember that all these symptoms are related to the disease process, and that the individual is not intentionally trying to be difficult. So that loss of initiative piece now becomes something that the care partner has to try to create in the individual to evoke some motivation and interest in activities. And oftentimes when that person with dementia is actually engaged in an activity, they enjoy that activity. But the hard part there is that it requires quite a bit of energy from the care partner to initiate the activity. So in some cases, when we think of loss of initiative, if the person gets up and the caregiver is quite tired, for them, it may be easier for them just to have the individual sit and watch TV rather than to motivate them in an activity. So that's where the day away programs and social rec programs are very nice to have available for people living with dementia and for their care partners to get a break. So as I said, these are the symptoms of the disease. How you see these presented in either yourself living with dementia or as a care partner looking after somebody with dementia. You may see several of these symptoms. Some of these may be more pronounced than others. And just appreciating the fact that for each individual, these symptoms are unique to the individual. We often say when you've met one person with dementia, you've met one person with dementia, because we are all unique individuals. So let's go into a little bit delving into what exactly Lewy bodies are. So Lewy bodies are made of a protein called alpha-synuclein. So in the healthy brain, alpha-synuclein plays a number of important roles in neurons or brains, or nerve cells in the brain, especially at the synapses. So where brain cells communicate with each other. So in Lewy body dementia, alpha-synuclein forms into clumps inside the neurons, starting in particular regions of the brain. So this process causes neurons to work less effectively and eventually to die. So the activities of brain chemicals important to brain function are also affected here. The result is widespread damage to certain parts of the brain and a decline in the abilities affected by those regions in the brain. So Lewy body dementia is typically listed as a type of dementia and can often, as you saw earlier in my earlier slide, can often coexist with Alzheimer's type changes in the brain. But what is often not known is that it is actually a spectrum of disorders involving disturbances of movement and cognition, behavior and sleep and autonomic functions. So experts actually distinguish two key forms within this spectrum. So dementia with Lewy body and Parkinson's disease dementia. So depending on where the Lewy bodies are present in the brain, the symptoms and therefore the diagnosis will be different. So when the Lewy bodies are found in the outer layers of the brain, which is the cerebral cortex, it is mostly linked to problems with mental abilities, which are the characteristics of dementia with Lewy body. Acetylcholine is a chemical that functions in the brain as a neurotransmitter, and in this case is depleted, so causing a disruption of perception, thinking, and behavior. So for Parkinson's, on the other hand, the Lewy bodies accumulate at the base of the brain where a person's motor movements are controlled. And I'll show you, in the next slide, I'll show you an image of just where that is. And here, the dopamine neurotransmitters are depleted. And this causes the symptoms to appear. So another distinction between the two is the timeline of diagnosis. So dementia with Lewy bodies is diagnosed when dementia has already been present within 1 year of the onset of the motor symptoms. Parkinson's dementia, on the other hand, is diagnosed if the onset of dementia occurs at least a year after the onset of those motor symptoms. So the 1 year cutoff time is generally accepted period by most clinicians for a diagnosis. The key here is that Parkinson's disease with dementia, and dementia with Lewy bodies occurs along a spectrum. And the way these are diagnosed are based on what the earliest signs of the disease are. However, they all end up looking very similar to each other as the disease process changes over time. So these essentially are not static conditions, as people who are afflicted with these diseases know. And this here is just an image of where, the cerebral cortex, where dementia with Lewy bodies begins. And if Parkinson's disease with dementia is in the deeper areas of the brain, as well as the cortex of the brain. So dementia with Lewy bodies is a progressive disease, meaning symptoms start slowly and worsen over time. The disease lasts on average about 5 to 7 years from the time of diagnosis to death. But the time span can range from 2 to 20 years. So how quickly symptoms develop and change varies greatly from person to person, depending on the overall health, age, and severity of the individual symptoms. So throughout the course of the disease, any sudden or major change in functional ability or behavior should be reported to your physician. The most common symptoms include changes in the cognition, movement, sleep, and behavior. So when we look at those symptoms, visual hallucinations occur in up to about 80% of people with a Lewy body dementia, often early on. They are typically realistic and detailed. They may have images of children or animals. The auditory hallucinations are less common than visual ones, but may also occur. So hallucinations that are not disruptive may not require treatment. However, if they are frightening or dangerous, so for example, if the person attempts to fight a perceived intruder, then a doctor may prescribe medications to ease that discomfort, and you can imagine the fear that the individual may have in that experience. So dementia is a primary symptom of the Lewy body dementia, and usually includes trouble with the visual and spatial abilities. And just reviewing all of those that I mentioned earlier, the judging distances and depth or misidentifying objects may be present, planning, multitasking, problem solving, and reasoning. You may also notice those things are changing. Memory problems may not be evident at first, but often arise as the Lewy body dementia progresses. So dementia can also include changes in mood and behavior, that poor judgment, again, that loss of initiative, confusion about time and place, and lastly, the difficulty with language and numbers. Cognitive function fluctuations, and that just makes it that much, the cognitive fluctuations piece makes it that much more difficult for doctors to identify. So that's the unpredictable changes in concentration and attention and alertness and wakefulness from day to day, and sometimes throughout the day for the individual. So a person with Lewy body dementia may stare into space for periods of time. They may seem drowsy or lethargic, or sleep for several hours during the day, even despite getting enough sleep the night before. So his or her flow of ideas may be disorganized, they may be unclear or illogical at times. But the person may seem better on one day and then worse the next day. So those are the roller coaster ride of cognitive fluctuations. And these cognitive fluctuations, as mentioned, are common in Lewy body dementia, but are not always easy for a doctor to identify. So you can imagine if the individual was going for some cognitive testing, and maybe at that particular time it was a good day, so they may present quite well on their cognitive test, and then the care partner may be saying, well, how could that be possible? I've seen all these changes in my loved one. And then the doctor says, okay, well, how about we do a follow-up in a few months' time and see if there's anything we can determine then. So and maybe in a few months' time, then when the individual gets tested again, they identify with a lot of these cognitive changes. So some people with Lewy body dementia may not experience significant movement problems for several years. Others may have them early on. At first, signs of movement problems such as maybe the fine motor, changes in handwriting may be very mild and therefore overlooked. Motor symptoms, the Parkinsonism, is seen early on in Parkinson's disease dementia, but can also develop later on in dementia with Lewy bodies. And lastly, or not lastly, but another point here is the sensitivity to medications. So they are extremely sensitive to antipsychotic medications, and doctors being alert to that fact. Sleep disorders seen in people with Lewy body dementia may include their REM sleep disorder. So that's a condition in which a person seems to act out dreams. So this appears in some people years before other symptoms start to show. They may have excessive daytime sleepiness, the insomnia, maybe restless leg syndrome, so the person feels the urge while at rest to move his or her legs to stop that unpleasant or unusual sensations that they may experience. And behavioral and mood symptoms, so that's where you see the depression, the apathy, potentially anxiety and agitation, delusions, and so they have those false beliefs or opinions, and paranoia may be evident in the individual. So Parkinson's disease with dementia, this type of Lewy body dementia starts as a movement disorder with symptoms such as slowed movement, muscle stiffness, tremor, and shuffling walk. So these symptoms are consistent with the diagnosis of Parkinson's disease. Later on, cognitive symptoms of dementia and changes in mood and behavior may arise. So very important to note that not all people with Parkinson's develop dementia, and it is really difficult to predict who actually will. So being diagnosed with Parkinson's late in life could potentially be a risk factor for Parkinson's disease dementia. And the reason why they say this is it could be because when we look at dementia, the risk of developing a dementia doubles every 5 years after the age of 65. So the older we get, the greater risk we have of developing a dementia. So some studies have shown that after follow-up, after 8 years, up to 80% of people that are first diagnosed just with motor features of Parkinson's disease may develop Parkinson's disease dementia. So it is very important to be aware that people who start off with Parkinson's disease and typical motor features are generally at a higher risk. What they say is potentially up to 6 times than the normal risk of the normal population of developing cognitive impairment and dementia. So as family members that are helping people with these diseases, we have to be aware of this in order to try to identify cognitive impairment early, because there is some treatment strategies that can help so that the person can live well with their dementia. And I'm just going to bring up a little image here, just again, kind of emphasizing the common symptoms between the two dementias and the fact that dementia occurs for Parkinson's disease dementia occurs after movement problems, whereas with Lewy body, dementia with Lewy body, it occurs before those movement problems. Okay, and the Lewy body pathology, where that occurs in the brain. All right, so here, I wanted to just go over some distinguishing features because with this specifying Alzheimer's disease as well into those features. So with Alzheimer's disease, the prominent problem is with memory storage that interferes with day-to-day activities. So people with Alzheimer's disease have trouble with putting a memory into their brain or into their memory storage area of the brain called the hippocampus. So therefore, a memory is never formed. And so people will often repeat the same questions over and over again. Even if you remind someone of what they forgot, it often doesn't come back to them. So when you look at somebody with Parkinson's disease and in dementia with Lewy body, it's different. The memory can go in, but people with these conditions have trouble retrieving the memory so that they may also, but less often, ask the same question again. So usually when you tell them, they have the recollection that the memory went in, and they may say to you, oh yes, you told me that. However, a couple of hours later, they may ask again, and you may remind them again, and they may have that recollection again that you had given them that answer. So that's the main difference between Parkinson's dementia and Alzheimer's disease. The reason why this happens is because there is different areas of the brain that are affected by the pathology or changes that can be seen microscopically in the brain when it's examined. Right. So causes and risk factors, many of us like to figure out, what is the cause of this, or how can I decrease my risk or delay the progression of this disease. So the precise cause of Lewy body dementia is really unknown. Certain diseases and health conditions, particularly Parkinson's disease and REM sleep behavior disorder, are linked to a higher risk of Lewy body dementia. While having a family member with Lewy body dementia may increase a person's risk, Lewy body dementia is not normally considered a genetic disease. So there is no specific lifestyle factor that has been proven to increase one's risk for Lewy body dementia. However, some studies suggest that a healthy lifestyle, including regular exercise and mental stimulation, and a healthy diet, might reduce the chance of developing age-associated dementias. Okay. So treatment and management, when we look at various treatment and managements of the disease, while Lewy body dementia currently cannot be prevented or cured, some symptoms may respond to treatment for a period of time. And that's important to note because we all want to live well if we have this condition, we want to live well with it for as long as we can. So a doctor can work with other types of healthcare providers to make that more doable for you. So potentially working with physiotherapists can help with movement. Speech therapists certainly can help with swallowing difficulties. Occupational therapists certainly can help identify ways to more easily carry out everyday activities to promote an individual's independence. Working with music, art, and rec therapists may provide meaningful activities that can help to reduce anxiety and improve a person's sense of well-being. Certainly working with the Alzheimer's Society support counselors can help people with Lewy body dementia and their families learn how to manage difficult emotions and behaviors and plan for the future. Support groups and learning series are another valuable resource for both people with Lewy body dementia and their care partners. Medications, so drug treatment is more complicated than that of treatment for Alzheimer's disease. And that's really because there's more symptoms to deal with in this particular case. So you have cognitive symptoms and movement symptoms and sleep disorders. And on top of that, the sensitivity to medications. So advice for people living with Lewy body dementia, number one, I would say is getting that help So by sharing your diagnosis with others, you can certainly build a support team to help you manage. Um, and by accepting of the other pieces, of course, you can build your support team, but also accepting assistance to help you reduce stress of those closest to you. It might be contacting the Alzheimer's Society to speak with support counselors, and that's part of building your circle of support. I mentioned I have here a link that goes to a medical alert wallet card, and some of these may be familiar with it, and I have an image of that on my next slide. If you carry a wallet card such as this around with you, it might be handy if you do require hospitalization or emergency medical care, or even when you're meeting with your doctors. So it contains important information about your medication sensitivities as well. Other things to consider is our planning for the future. So the planning ahead piece, identifying local resources for home care, meals, and other services before you need them, not when you need them. So you know who to call, and when the time comes for those supports. And the Alzheimer's Society support staff can certainly help you with that too. Make a list of events and activities you can still enjoy, and then find a way to do these activities. And it might be listening to music, it might be exercising, or going out for meals with families and friends. So really it's about, adapting to these brain changes that you're experiencing and still maintaining some level of control and quality of life. So here's an image just of that medical alert card that you could put in your wallet. I know we have little cards too at the Alzheimer's Society that specifically say, I have a condition that causes me memory loss. Your understanding is greatly appreciated. And one individual that's a client of ours has referred to that card as her business card. So she pulls that out whenever she is having difficulties communicating her message or understanding what others are saying. And certainly when we think of the number of individuals who are impacted or have a diagnosis of dementia, the understanding is there once those cards are presented. We also have cards for care partners that say on them that my loved one has a condition that causes them memory loss and confusion and some unusual behaviors. So your understanding is greatly appreciated. So care partners can also use the card to slip to a waiter or waitress, or in a time when it's appropriate to do so. So caring for persons with Lewy body dementia, I think number one is really becoming informed. So participating in sessions such as this webinar today. It might be taking part in a First Link learning series provided by the Alzheimer's Society to become more knowledgeable and understanding about how you can support your friend or family member. Recognizing yourself, and very important, recognizing yourself, your strengths and limitations. And this may require adjusting your expectations. Watch for signs of physical or emotional fatigue, such as irritability, withdrawal from friends and family, and changes in appetite or weight. And oftentimes I refer to that as your stress checklist. Very, very important to recognize what bad stress feels like, and then what is causing you stress, and then how is it that I can seek support to alleviate that stress in my life. Learn to accept help when it's offered. Again, it's that accepting piece, and learn to ask family and friends to help. Contact the Alzheimer's to help you to navigate the system. It can be quite overwhelming and complex if you're already stressed. Attend support groups, encourage others to contact the society so that family or friends unfamiliar with the disease can also become more knowledgeable about how it is that they can support your loved ones. And then looking at research. So Lewy body dementia is also of great interest to the Alzheimer's and Parkinson's disease research communities. Lewy body dementia represents an important link between these other brain disorders. And research into one disease often does contribute to better understanding of others. So many avenues of research focus on improving our understanding of Lewy body dementia. Some researchers are working to identify the specific differences in the brain between dementia with Lewy bodies and Parkinson's dementia. Others are looking at diseases underlying biology, genetics, and environmental risk factors. And still other scientists are trying to identify biological indicators of the disease. So improving screening tests to aid diagnosis and research those new treatments. And here, just for your information, is knowing what kind of programs and services we're offering through the Alzheimer's Society. And I was mentioning to Caitlin before I went live that even despite this unusual circumstance of having this pandemic happen in our society with COVID-19, we're still continuing to offer counseling and support groups in our First Link Learning Series and other programs and services via other platforms. And I'm actually pretty thrilled with how individuals out there are really embracing taking on this new way of learning and utilizing this technology. So that's something that we can, one thing that we can certainly take away from this experience, this unfortunate experience that we're going through today. So the Alzheimer's Society Grey Bruce is a registered charity. Just knowing the money raised in Grey Bruce here stays here to provide information, education, support, and counseling services for individuals, families, and healthcare professionals. Less than 60% of the cost of our budget is funded by government or other outside sources. And support through donations ensures that together we continue to make a real difference in the quality of life for individuals with dementia and for their families and caregivers. So I thank you. Thank you very much for your active listening here today.